Hello to everyone. Welcome. I am Sarah Ramaya, Curriculum Designer at ASRM. Welcome to a webinar for patients taking care of yourself during the COVID-19 pandemic, hosted by the American Society for Reproductive Medicine and the ASRM Mental Health Professionals Group. Before we begin, please note, all attendees will be muted except the presenters. Time at the end of the presentation will be reserved for questions. Please type your questions in the question chat window at any time. We will read as many selected questions as possible to the presenters during the allotted question and answer time. A recording of this webinar will be archived on the ASRM website in the coming weeks. Please watch your email for notification. To introduce our speakers today, I will turn this webinar over to Dr. Anne Malavé, Chair of the Mental Health Professional Group at ASRM.
Thank you, Sarah. So we have two panelists today. I'm going to read this. I am Anne Malavé, I'm Ph.D., Chair of the Mental Health Professional Group of the ASRM. I'm a member of the ASRM COVID-19 Task Force. I'm a professional support group leader and past chair of the Support Group Oversight Committee of Resolve, the National Infertility Association. I'm a clinical psychologist, a fertility and adoption counselor, and a relations psychoanalyst, graduate faculty and supervisor at the William Alanson White Institute. I maintain a private psychotherapy practice in New York City, and I provide consultations and assessments for third-party reproduction. Our guest speaker today is Barbara Collura, who is President and CEO of Resolve, the National Infertility Association, the oldest and largest patient advocacy organization for people struggling to build their families. Resolve's headquarters is in McLean, Virginia, just outside Washington, D.C. Please note that the views expressed here do not necessarily reflect the views of the American Society for Reproductive Medicine. So for me, Anne Malavé, I have nothing to disclose. And for Barbara Collura, she is employed by Resolve, the National Infertility Association. So the learning objectives for today are understanding and support, information and resources. As the host, I would really like to express a very strong welcome to Barbara Collura and also to our audience today. This webinar is intended for everyone who accesses reproductive medicine. And if you want to learn more about the Mental Health Professional Group of the American Society for Reproductive Medicine, or ASRM, as we call it, the American Society of Reproductive Medicine, or Resolve, the National Infertility Association, there'll be information in the resources slide at the end of this presentation. So, Bob, can you maybe tell us what you're hearing at Resolve, what patients are saying?
Hi, Anne. First of all, thank you so much for having me on. I just want to make sure you can hear me okay.
Yep, I can. Thanks so much.
So patients are saying a lot of things. As you and I know, we've been in this field for a long time, and this is a community that oftentimes feels isolated and alone. And boy, are we all feeling isolated and alone right now. But our patient community is feeling some other really important feelings. They're feeling fear of the unknown, fear of COVID-19, fear of will they ever be a parent. That fear can sometimes turn into anger. We're certainly seeing both the fear and the anger. There's a lot of uncertainty. When is this going to end? How is this going to end? Will I be safe? Will my family be safe? Uncertainty around people's jobs, and we're hearing even, Anne, uncertainty around will my IVF be covered by insurance now? So there's a lot of uncertainty. In fact, just me telling you that list of things, I get sort of a butterflies in my stomach, and that's that anxiety that so many of us are feeling, and certainly our community has heightened anxiety. There's also a feeling of loss. One of the things that we know about the infertility journey is just that loss of control, that just tremendous loss of so many things being out of your control. And we're certainly feeling that way today, and our community is feeling it deeply. And then there's this hopelessness. There's this just all of those unknowns and uncertainties are causing people to really lose hope. And you know, that's one of those things that you just grasp onto, and it gives you that momentum to move forward. And when you have that feeling of hopelessness, it becomes really difficult. I know that sounds like a laundry list of really you know, not positive things. I do know that people are being reflective, and they're taking this time to reflect on their journey, perhaps using maybe a little bit of the extra time they have to exercise, to create some new positive habits, or maybe to lose some negative habits. But this community, Anne, that you and I have supported for so long is hurting right now. And I'm hoping that today we can leave them in either a better place or give them the tools that can get them to a better place.
Well, I think you put it really well, Bob, and I would add a couple of things, which is guilt. I noticed that a number of the women that I've spoken to feel guilt about one thing or another. And yes, the anger and the incredible loss. And I'd also like to add that anxiety itself is contagious. So that's another sort of threat that can spread like wildfire also. But I agree with you. We're here to help people learn how to cope. And at the end of this call, hopefully people will feel hope, as well as learning some coping techniques. So I'm going to start with talking to you about understanding the threat. Because in order to cope with any challenge, we first of all need to be able to identify what that problem, what that challenge is. And this COVID-19 threat, which is it's an unprecedented crisis of unimaginable proportions, which I think most people would think is the greatest health threat that's ever presenting itself to this country and also on a global level. And it may overwhelm, in fact, I would say it does overwhelm a person's regular capacity to cope, either intermittently, or some people feel that they're just overwhelmed and unable to cope in general. So understanding the threat, we need to recognize and validate the impact. Everything that Bob just said is true. Everything that Bob just said is normal. These are normal reactions to an extraordinarily terrible time. So we need to recognize and validate that the invisibility, the uncertainty, and the social isolation often results in normal and expected feelings of panic, anxiety, fear, terror, helplessness, hopelessness, loss of control, fear for loved ones, fear of dying, financial concerns, and for this population, a deepening of all existing issues related to trying to build a family. So we'll come back to that. The pandemic is deeply disruptive. It attacks safety, security on every single level, and it creates incredible disorder. On a macro level, we see this playing out around the world and in this country, and we're here to talk about how it disrupts a person's capacity to cope and to cope with their relationships. It can be disruptive in relationships also. So there are incredible losses, and this is for a population of people who've already been sustaining loss after loss after loss. So your feelings are normal. The last thing we would want to do is to pathologize these feelings. They are completely normal. You are not alone. I'm going to talk about some common reactions and some differences, and then see what Bob would like to add to this. So some of the similarities that we all experience are that we are in fight or flight emergency mode. This is a reaction to this incredible stressor. It's very elemental and primal. So we're seeing things in black and white, our adrenaline is rushing, we're feeling that we need to escape. Except with this pandemic, of course, it can feel like there's nowhere to run, nowhere to hide. And also, what happens in a situation like this is we use our existing coping mechanisms. That's what we tend to do. It's very difficult, but of course it is possible. That's what we're here to talk to you about. But it's difficult, especially at the beginning of this threat, to learn new coping mechanisms. People tend to depend on what they already use. So then here we come to some differences in how people react. I'm going to mention just a few of them. So people have different personality styles. So one way of looking at this is that some people are introvert and some people are more extrovert. So we would expect that perhaps the introvert at the beginning might feel a little bit more comfortable with the social distancing than the extrovert, and it might be harder for the extrovert. I actually think that can change over time, but these are some different ways that people can respond to the initial shelter in place or the quarantining or the social distancing, and that some people find it harder than others. Then coping. Some people cope by using a take charge, let me try and control things. Those people get very active and try and figure out all the different ways of cleaning and the latest on the CDC website, and they take action and they get masks and they do all this kind of stuff, and that's how they cope. But another group of people rely on denial, and these people I think are often misunderstood because it looks like they don't care when they're minimizing or it might seem like they're minimizing the threat, but in actuality they're coping the best way they know how, by using denial. Now, one of the ways it's important to note these different coping styles is this is a major source of problems in couples. I find that often couples utilize different coping mechanisms, so that one partner is saying, oh, there's an emergency, we got to do this, 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 and this. And the other person is saying, you're overreacting, it's not necessary to wash my hands as much, this kind of thing. And that can lead to a lot of couples conflict. But I'm going to hand this over to Barb before we talk more about how this impacts patients.
Yeah, Anne, thank you so much, because I'm sitting here listening, and so, if I didn't know better, you were just describing the infertility journey. I'm not laughing. I mean, it's just uncanny how the reaction of people in the world to this pandemic, understanding the threat of COVID-19 is so much like the family building journey and that infertility journey. I'm almost sitting here thinking, I wonder if we're almost better equipped because we have felt alone, we have felt isolated, we have felt out of control, all of those things. But for the first time, now everybody is feeling that way. So I think, again, realizing that, normalizing it, one of the things that I'm sensing in the infertility community is that people are supporting each other and coalescing around each other, but there may be people thinking no one else feels like this. And what I just heard you say is, because of the unusual threat and this unusual circumstance, in actuality, many people around the globe are feeling this way. And I think that's, in some ways, you kind of let a deep breath go and say, oh, wow, this is normal, and this is what everybody is feeling, and now I have this extra layer on top of it. So I just I really appreciate kind of how you walked through that, because that's what the infertility patient is feeling.
Okay, thank you. How does this impact patients? Well, Bob, you just led into exactly what I wanted to focus on next, that these are not new feelings. These are very, very familiar feelings for anybody that's tried to build their family, that's had losses and delays and all the things that people go through on their infertility journey. The loss, the life on hold, feeling the social isolation. And all the feelings that you've had on your fertility or infertility journey will be exacerbated during this. So that has different sides to it, which I'm going to go into. But you're saying that you're seeing this in Resolve, right? That people are connecting that this is similar to what they've gone through before, Barb, right?
Yes, of course you said it in a very beautiful way. I've heard people say, you know, gee, all of this is now just getting piled on top of me, and I'm feeling even, you know, it's, gee, everything I've been feeling is now amplified. You know, those are the kinds of phrases and words we're hearing the community say and talk about. So it is very much in line with what we're hearing here at Resolve.
Well, I'm going to talk a little bit more about the different ways in which the challenges on the fertility journey might impact a person's experience going through this, because I think it can go in different directions. And the different reactions are of course determined by that particular person's history, their experience, and particularly how much trauma they've experienced either on their fertility and fertility journey or in other areas of their life, and whether healing has occurred or not. So it's very important, I think, to recognize your personal response to the situation. Some people, for example, who've had a lot of trauma and may feel more isolated during this, may feel like, oh, you know, this always happens to me, everything always delays my cycle, I'm feeling separate from others, you know, people are going through this pandemic and they're sort of all connecting together and doing all these, you know, the cocktail hours and this and that, but I'm feeling more and more separate and alone and isolated. That will be the experience of someone who's been through an awful lot and has not yet been able to do the healing necessary for them to feel connected to other people. And there is hope, we'll come back to that. And then there are other people who have, I would say, either had not quite as much trauma or have been able to get help, get support, get healing. Some of those people are saying, I know how this goes, I got this. And feeling relief, feeling like, oh, welcome to my life. Finally, people get what it's like to feel that their life is on hold, that they can't do the simplest of things, that everything is determined by this dreadful pandemic, which is exactly what I've been going through for years, trying to have a baby. And now I feel this sort of, not that people would wish it on their worst enemy, but now I feel connected to others. Now I feel we're all in the same boat. So I'd like to emphasize that these are just two particular responses, but different approaches, different reactions are normal and expectable. There's nothing pathological. This is just human beings doing the best they can according to whatever they've been through in their lives. And there's always the possibility of developing resilience, strength, and post-traumatic growth. In every crisis, there's an opportunity for change and growth. Did you want to add anything to that, Bob?
No, I think that is beautifully said, and again, I just want to emphasize that this is normal, and there are tremendous opportunities for our community to grow and learn, and I like that word resilience, and really develop that resilience. So no, I don't have anything else on that.
Okay, thank you. So how do you take care of yourself? So I'm going to talk about some coping strategies. So first of all, it's really important to feel the feelings. It can be very tempting to try and escape them, not that anybody can really, but it's really important to understand, validate, and feel the feelings and recognize that this is just normal and valid. And it is important to do that in a way, however, where you don't drown in the feelings. You know, sometimes it can be helpful to set a timer and sort of feel the feelings and then get up and do something completely different so that you don't disappear down, you know, a black hole of feeling. Then it's important to have a plan, being proactive, taking action, and having agency is healthy. If you are doing something and acting on the world, that is a much healthier experience than having the experience of only having the world act on you, only being the passive victim of things that are going on. So it's important to have an action plan. So social support is absolutely vital. And I like to say that we are social distancing, but we still have to remain social, and that we may be working remotely, but we must not be remote. So it's very, very important to have that social support and to connect with groups. The groups could be your family, your co-workers, your friends. It could be Resolve, it could be a support group, it could be a book club. There are many ways, but we know that connecting, membership in a group is very, very protective. It's a protective factor that helps people cope. Structure. We all are organized around daily rhythms. This is a major way that we feel safe. And we've had all those rhythms disrupted and taken away from us. So we have to recreate rhythms. A lot of people are saying that they feel that they don't know which day it is. One day blurs into the next, and it feels like there's no separation from work to play and so on. We have to, as soon as we are able, we have to rebuild a structure, and we have to rebuild some predictability in our lives. I'm very fond of telling people to watch a movie they've already seen, because they know what's coming next. They know it's one thing they can predict. So we need a structure. So I'm sure we've all heard of the idea of one day at a time. Anybody who's familiar with 12-step programs, and I'm a big fan of them, is very familiar with a lot of coping techniques. And also what sometimes people might not know is that you can have 1 hour at a time. If you're feeling overwhelmed, let me just focus on the next hour. Of course, it could be half hour and so on. All these kinds of ideas are extremely helpful in coping. Some other things. It's important to limit exposure to news and social media. It's also important to limit talking about it. It's important to talk. It's important to be able to reach out and share. But sometimes the talking about it ends up becoming re-traumatizing. Remember, I said that anxiety is infectious, it's contagious. And so sometimes we have to be careful that we're not talking to other people or on a Facebook chat or whatever it is in a way that ends up making us feel worse than when we started. Exercise. And I'm not just talking about physical exercise, mental exercise. Something like doing a puzzle, or something like, I don't know, watching birds, doing Sudoku, something that keeps us alive and active, and also gives us something else to focus on. Do something you enjoy. It's terribly important in life to have something to look forward to. And people do have to be creative, but it's very important to do something you enjoy. So seeking out, back to the idea of social support, there are peer and professional support groups through Resolve. There are both wonderful resources for people, and members of the mental health professional group of ASRM, many of them run support groups. In fact, there's an overlap. Many MHPG members are also Resolve support group leaders. Volunteer. Altruism is very, very healing. I like to say when you're giving to someone else, it reinforces that you have something good inside. Because by definition, if you're giving, that means you have something inside to give another person. It can also be profoundly healing to focus on somebody else. It takes you away from your own concerns about yourself. Be patient and kind with yourself and with others. We are all human, and we will all experience the best and the worst in other people, and the best and the worst in ourselves. We need to cut ourselves and each other some slack. Practice gratitude. Gratitude is very, very important, very, very healing, very, very reassuring, and very much a part of developing resilience. And finally, where possible, try to avoid unhealthy habits. Try to avoid turning to smoking, alcohol, substances, and so on, if possible. If that's not possible, get professional help. Bob, did you want to add something about how to take care of yourself?
Anne, you've mentioned that anxiety is contagious. I have never heard it put that way, but that is really profound. And when I think about fear, you know, when I talk to my friends and my family members, we all have a lot of fear about COVID-19. And I think the way that we're trying to overcome our fear is with information, facts, right? Valuable and helpful information, so that our, you know, I'm thinking about when I'm talking to my 90-year-old mother, and right, and I'm trying to make sure that I'm providing her with facts and so forth, so that her fear. When you think about our population and you think about this fear, is fear contagious as well? And what are ways in particular that we can cope with our fears that we have?
Well, I would totally agree that fear is contagious as well as anxiety. There's a sort of an overlap. I would say hope. Hope cuts fear. Hope makes it possible for people to get through this. Hope is absolutely essential. Hope, social support, and some of the other things. But hope, I'd say, is top of the list that I would recommend. And sometimes, often, I think going through this, people lose hope. And that's a time when they have to rely on the hope of other people and the hope of groups, and that gets a person through. Nobody goes through life without losing hope at times. This is just part of being human. So we need to lean on each other and find other people's hope that'll get us through until we can see our own hope again.
Thank you. I think this one is me. One of the things that we talk about a lot at Resolve is how to advocate for yourself. That could be our history of advocating for insurance coverage and advocating for pieces of legislation. But right now, it also means to, as you've said, Anne, to take care of yourself, to give gratitude to yourself, to be easy on yourself, to give yourself permission to perhaps indulge in maybe you know, some binge watching and so forth. But it also, in light of your fertility journey, we know that there are ways that you could be advocating for yourself right now. And the first one is to ensure that you're in regular touch with your healthcare providers. If the way that they've been communicating with you is via their Facebook posts or that sort of thing, reach out and ask for a telehealth or telemedicine appointment. There's a very good chance that they'll do that at no cost, or that even your insurance would now cover the cost of that. When you get on the phone or in a video call with your clinic, with your healthcare provider, it might be the nurse, it might be your doctor, talk to them about how you're doing. Ask them what you could be doing right now while you're home during this time to maximize your future care. They may be doing some visits with patients. They may not be doing any visits. We know a lot of governors across the state, across the country have shut down care. But ask them what you could be doing now. And we encourage you to advocate for yourself and to reach out. They want to hear from you, and I know that that they will appreciate you asking questions and for you really speaking up. It might be that that you need some extra support right now, ask your clinic first what resources they may have. They may have mental health resources on their staff that you probably didn't know about. They may already have relationships with local mental health providers that are either part of ASRM or part of Resolve. Again, you may not have needed that in the past, but ask them and really push for that. Maybe, you want to find a support group and you have no idea what that is. You've never done one. You can go to our website, resolve.org. We have right on our homepage how to get COVID-19 resources. And when you click on that link, it's going to tell you how to get connected with a group. None of them are meeting in person. Don't worry about that. But we have many, many groups across the country that are meeting virtually. And we don't want you to be without support. Some of us have a hard time sharing our journey with our friends and family, and connecting with others who are going through the same thing is very, very helpful and comforting. I can't stress enough how connecting with others, as Anne has said, through a professional mental health provider, through your clinic, through a support group, through a Facebook group. There are lots of Facebook groups that are providing people connection and support. And I would just ask yourself, am I entering into a supportive community that's going to actually help me get somewhere where I am better, where I am feeling better, where I have a better outlook, where I get to that place of hope that Anne referenced? One of the things that I find when I start watching too much news is it becomes really toxic. And my family has had to basically advise me what I shouldn't be doing because it becomes toxic for me. That may be the case with you too. So I would look at, it might be a friend relationship, it might be a family relationship, it might be in one of these Facebook groups or somebody you've been friends with online that you kind of now are going to take a different look at and say, right now, with what I'm going through, is this a helpful relationship or is this a toxic relationship? And really advocate for yourself and help yourself get to a different place. There are resources out there. Your healthcare provider, your clinic, your nurse, they want to help you. Resolve wants to help you. The whole community wants to help you. And this is an opportunity for you to kind of put yourself out there and ask for that help and share where you are, and then look for how you move yourself forward. Yeah, anything else you'd like to share there?
Yeah, I'd like to say that any action towards doing something to increase your self-care, to get your self-help information, support, anything that you do is incredibly valuable. And of course, all of you who are listening to this right now, who may be listening to this webinar in the future, when you finish listening to the webinar, I hope you're able to say, I just took a step towards getting help for myself and improving my situation. I acted on my experience. I took an action rather than being somebody that just had something happen to me. This is healthy. This will lead to growth and positive change and the development of resilience.
And can I just say one more thing that your comments just prompted me to think of? There are a lot of resources out there online. I know clinics that are putting really thoughtful blogs out there. I know mental health providers are putting really amazing blogs out there. That's just in our space. But then there's also a lot of new online resources, literally, that have just popped up in the last 10 to 30 days, where you can reflect, you can journal, you can meditate, learn breathing techniques, do yoga at home, but also to help kind of you learn perhaps your next steps in your family building journey. Maybe this is the time where you decide to do a little bit more reading, or you want to read a memoir of somebody who's gone through an infertility journey and you just haven't had the time. There are opportunities like that that I think can be extremely helpful and help you learn and grow as well. So I just I want to make sure people recognize the tremendous resources that are literally brand new that are out there now.
Yeah, and what you're also talking about is time. People can use this time for growth. They can use this time to reflect on their fertility and fertility journey. And people may end up making different choices when this is all over. And, you know, as a result of having been forced to take a step back and just look at the larger picture, we shall see. This is not a bad thing. Obviously, it's nothing anybody would have wanted, but good can come out of it.
Well, this slide, it's really the mantra of Anne and I, which is you are not alone. You are not alone. I want you to get off this webinar, find a mirror, and I want you to look at yourself in the mirror, and I want you to say out loud, I am not alone. I am not alone in this. And just wrap yourself in that knowledge. There are tremendous resources out there. Certainly, Resolve is one of them, but we are not the only one. There is a community for you. We think of the word community as being able to touch and feel and be with people, and that feels really foreign right now. That feels like it's impossible. But we are seeing community every single day, every hour of every day, where people are really coming together to support each other, to reach out and to connect. And let's embrace that. Let's make sure that we are finding all of the available resources, and if we stumble upon a community and it's not working for us, find another one, because they are there, they're welcoming with arms wide open. And I know from my personal journey with infertility, and I know after being connected with Resolve now for 20 years, that power of community and knowing you're not alone is incredible. You will feel like a superhero. Find your community.
Thank you. I would say Resolve rocks. I would just like to emphasize a couple of things in closing. First of all, your feelings are valid and normal. And I'd like to talk about 3 defining characteristics of what it means to be human. As human beings, first of all, we're social animals. Secondly, we adapt and adjust. That's what we do as human beings. And thirdly, we make meaning. So first of all, being social, during social distancing and quarantining, make sure you remain social. Secondly, you can adapt. You can develop coping skills. You can grow resilience and achieve post-traumatic growth. And thirdly, be careful that the meaning you create comes from hope and not from fear. So we've come up with some resources here. I think they're pretty much self-explanatory. The first one, www.reproductivefacts.org, is the American Society for Reproductive Medicine's website for patients. The second one, of course, is Resolve. You can find mental health professionals either on the Resolve website or on this third resource for the mental health professional group of ASRM, also with the directory for Resolve. Bob already mentioned the support groups that Resolve hosts, peer and professional, and I said many mental health professional group members also run groups. The Resolve online support community, and finally 2 helplines. Sometimes people who are going through this, who have existing problems, just feel that this just becomes too much. Help is always available. So now I think we open this up to the Q&A. Thank you for listening.
Thank you, Anne and Barb. We will now open up the floor to questions for our presenters. Please send in your questions through the question chat box located in the gray toolbar to the right or maybe the bottom of your screen. Jessica Goldstein will be moderating the session.
Hello, everyone. I'm Jessica Goldstein, and I'll be reading selected questions out. This one is for Dr. Malavé. Unfortunately, the questioner writes, unfortunately, I am unlucky with DOR. I have been doing labs and seeing my fertility declining month over month. I'm working with a counselor, but the best thing I can do right now for my sanity is to be able to move forward with cycles. How do you advise me to cope with the feelings of realization that that's not possible right now?
Well, you certainly are not alone. There are many, many, many people in your situation. And it is indeed, I mean, there's, no words. It's an incredible loss, an incredible challenge. However, I'm glad to hear that you're working with a counselor. Good for you. This is very, very positive. If you have not yet experienced delays, and I imagine that you must have done, this may be the first time that you have had to deal with how do you manage not being able to move ahead when you want to. And I expect you've probably been through this a lot. So I think if you've already found a way in the past, no doubt there was a time when someone said, I don't know, there's an infection, or there's a delay, or there's a an insurance problem, somebody switching insurance. I would expect that you probably have already had experience dealing with delays. And I think if you can, try and remember and go back and search your memory for how you have coped then, and galvanize those coping moments and try and transfer them onto this situation. Because no doubt you have already had times when you felt that you could not go on and you could not wait any longer, and yet you had to. So if you could try and reflect, reach back, pull those into the presence and use them. The other thing is, it can be helpful to think about, how can I get healthier? Not to get healthier because this is going to be the magic that'll, get you pregnant, but healthier because, this is something that you can work on. It's something that you can take control over, and it will help you going through whatever comes next. So it is totally tough, but it totally can be managed. It can be overcome. There are going to be good days and bad days, but I think that reaching out and knowing you're not alone is absolutely essential. Did you want to add something to that, Bob?
This is what we've been hearing at Resolve, and just hearing this person's question, I'm getting emotional. I mean, my heart just wants to break. And I think you said it earlier on one of your slides. I mean, one day at a time. Each day seems really long. These last few weeks have seemed like months. It's hard to believe that we've been in this, 30 days when it feels like 6 months. I think one day at a time, focusing on your health and looking forward to getting back into that clinic and into that practice and seeing what happens. You're going to get back in there. You're going to get back in there, and you've got to focus on where you want to be when you walk through that door, and make that happen. And I think that's focusing on your health and your mental health now, and one day at a time. But great advice, Anne, of course. See, a professional. That's, I mean, Anne, you give such sound advice, and this so well, and I think that just is reflective, if you haven't already figured that out from this presentation, how deep and involved this journey is. And I say this a lot: treat this with the utmost respect. If somebody's going through cancer, everyone expects it to be a crisis in their life. If somebody's going through infertility, we don't talk about it. But I always say to people, treat this journey with care. Get all the support and help you need, because you're going to need it. You're going to need it. This is a journey that can really mess you up. And if you're supporting yourself and taking care of yourself, you're going to end up in a place where you're feeling a lot better. And I can't stress that enough, especially now. If you're one of those people that said, I've had it under control, now may be the time where those cracks are starting, and it's okay. It's totally normal, and it's okay. You're not a failure. We all need help right now. Get that help, and you're going to connect with people like Anne and others who really know this deeply, and can make a huge difference in your journey.
Just like to add one thing, which is that I think that people going through the fertility journey, particularly with your situation, it can feel that the only thing that matters, you know, is that next cycle, the only thing. And of course, without doubt, that's really, really important. But this can be a time where you expand that worldview and you increase the self-care, you increase the coping, you get connected with more people. So as hard as it is possible to get through this, and this will pass. This will pass. Next question, please.
This is for Barb. Is there a cost associated with the virtual support groups offered through Resolve?
That's a great question. There's no cost for our support groups, period, whether they're in person, which they're not happening right now, or whether they're virtual. Everything is free. Our support groups, just to give people a sense of the size, we have about 200 support groups that meet every month across the country. Those are all, the peer-led support groups are free. The ones led by professionals, depending upon the length and the size, will have some fee associated with to those professionals, but the Resolve peer-led ones are free. And now those monthly support groups are meeting virtually, again, free.
Thank you. This is for Dr. Malavé. Do you know of any resources for people waiting to go through IVF with no infertility diagnosis, but a genetic condition that we are trying not to pass on? That has me feeling very alone, and I don't know anyone else in my situation.
Well, I think that's hard, because as much as it would be great if there was a group for every different category, I've never heard of a group that's directed only at that particular category. But I think that the benefit of groups, the large benefit of a group, other than knowing that you're not alone, is finding the common ground. And there is common ground, regardless of what the issue is. So I would encourage you to look into the peer groups, the professional groups, perhaps the sort of tailoring that you might feel you need. You might have to find that one-to-one with somebody that really knows the territory. So there may be other resources that I'm not familiar with, but I would say don't wait till you find the perfect group. There's enough common ground that you can benefit from talking about your feelings and connecting. And I think there are other people that go through different kinds of experiences, like people who have been diagnosed with cancer or various other kinds of illnesses, diseases, conditions. And you may find in a group, particularly a larger group, that there are somebody who has a similar situation. But don't let it stop you. Don't wait for the perfect group to come along. Get right in there and talk about it, because knowing that you are being listened to and that people are hearing and witnessing your story is very, very powerful and extremely therapeutic. So I wish you well.
And can I add one thing there? I don't know if this person is already in a fertility clinic patient population or has already identified a clinic. One of the things that all the clinics are doing that I know of are doing consultations, some of them for free. And one of the things you might want to think about is doing a consultation with even a couple of practices and sharing with them your concerns. And honestly, they might have some resources for you as well. There might be a mental health provider on their team who they would recommend that you connect with. But look, there's a lot of people that were just starting, hadn't even gotten in the door yet, and we're just starting, or people who are maybe 9, 10, 11 months into trying and it's not yet happening. This is the perfect time to be proactive. Do these consultations, learn, find out what you could be doing health-wise. I have been hearing about patients actually moving through the family building journey over these last 30 days, all of it via telemedicine, you know, determining that they might need to use a donor, picking their donor. I mean, it's been inspirational in many ways to hear what people have been able to accomplish through telehealth and telemedicine. And these consultations and this doing your research and feeling like you're gathering information, I think it's perfect. I think it's a perfect time to do that if you are not yet in the door. And if you are in the door, go back to your practice, your doctor, and ask them as well, are there other resources that I can be talking to help me? So I hope that that helps as well. Reach out. These practices, I think, are really liking and wanting to do these consultations.
Thank you.
Thank you. For the very last question, sorry, that's all we have time for today. I have a comment from one of our attendees that hope is a dangerous thing for women like us. Keeping our hopes up and then getting let down month after month just makes the hurt even worse. Why should we stay hopeful when we have no idea when clinics might open back up and care can resume?
You want to start with that, Bob, or shall I? No, I'm going to jump in.
Jump in, please.
I think you have really just captured the struggle between hope and hopelessness. As much as you're saying, why should we have hope? That's hopelessness talking. And we can all understand why. I think you're making a really good point. So it's very important that you don't ground your hope in something turning out the way you exactly want it to be at the time you want it to happen. It's really important that you ground your hope further ahead into the future. This will pass. You will have opportunities. You might not have the opportunities that you want at the time you want them, but there are many, many possible ways that people build families. And people often start off feeling it has to be a particular way. And I don't know your journey, so I don't want to assume that I know that what I'm saying fits you. But for many people listening to this, I like to say that the fertility journey is often one of making the strange familiar. An option, a third-party option, might start out as feeling that it's something that you'd never, ever want to do. And with time and reflection, and perhaps things not working out and delays of one sort or another, that may end up being something that becomes very familiar and positive and exciting. You may end up becoming a parent or parents in a very unexpected way, because something that started off feeling like a poor option becomes a good option. But hope may seem out of sight, but as human beings, it's vital. Find someone to lean on. Reach out for a support group. Talk to a mental health professional. And I really wish you the very best and hope that this turns around for you in the future. Bob, did you want to add anything?
I mean, that line between hope and hopelessness, Anne, right? It can be such a fine line for people on this journey. It's that loss of control, and now you've got other things coming at us that, wow, are really, really out of control. Listen to what we've said on this webinar. Connecting, finding support, finding a community, self-care. These are things that isn't going to happen overnight. You're not going to start this tonight and feel better tomorrow. It's a process day in and day out, and you're going to start seeing some changes in, gee, I haven't thought about it 20 hours today, I've only thought about it 10 hours today, or whatever the case may be. You're going to see those small steps, but trust what Anne is saying, that it does make a difference. We know this, not because of seeing a few people. This is thousands and thousands of people over many years. This is exactly what's going to make a difference. Each of us are unique. I'm not saying that we're all the same and we're all robots, but connecting with others, taking care of yourself, finding that support is really going to make a difference on where you come out of this. I don't want to say the end of your journey, but as your journey progresses. And what we want for you more than anything is that you are whole, you feel hopeful, you're feeling good about life and yourself, and that's what we want. We want to leave people in a place where that's where they're going to end up, wherever that journey may take you. These are the steps that we know are going to be so critical for you reaching that. And I just want to thank you for having me. I want to thank you for sharing your wisdom and your experience with this audience and with our community. And I want to thank you for all the support you've given me personally over the many years, as well as Resolve. You're just such a champion for our community, and I thank you for that. And thank you for putting this webinar together. And I thank all of you who listened and provided your questions.
And thank you, Bob. Thank you, everyone. Wishing you all the best. Goodbye.
Stay safe. Thank you.
Thank you, Anne and Barb, and to the attendees. You will receive a survey by email after the session. Your feedback helps give you the most relevant content, and your input is appreciated. This session was recorded and will be available on our website in the near future. Please keep an eye out for an announcement on our next webinar. Please don't hesitate to contact us. For any questions or comments, email us at webinars@asrm.org. Once again, thank you, Anne and Barb, for sharing your valuable insights. This concludes the webinar.